Now with a report on infant asphyxia, here's our reporter Laura Windsor.
Roger, oxygen deprivation during or just prior to delivery can cause severe neurological damage and a requirement for lifelong care. Dr. William Liu of Lee Memorial Health System tells us about a breakthrough technology called whole body cooling that offers hope.
Whole body cooling is probably the latest in a series of medical advancements targeting neuroprotection for asphyxia. And it's a technology that really is present in the adult world, and a lot of the research initially translated through animal research has surfaced with good clinical evidence in the neonatal world. And it's only recently we've started to initiate in the community-based centers an initiative called whole body hypothermia. And it's based upon a lot of clinical research, largely through the NICHD, that has looked at studies, randomized clinical trials, that have looked at babies who are asphyxiated. And they're finding that babies who are asphyxiated, who have what we call neonatal encephalopathy, can benefit with acute neuroprotective intervention where their body temperature is cooled, usually to about 92 to 93 degrees Fahrenheit for about a 72-hour period. And what we're finding is that this cooling process is neuroprotective. It allows the child to have improved survival with less neurodevelopmental delay, and independently decreased neurodevelopmental delay on long-term follow-up studies.
What are the causes of oxygen deprivation?
There can be a clinical condition at the time of the delivery of the baby, usually what we call a perinatal event, where there is, for example, an abruptial placenta, where the placenta may be disengaging from the uterine wall. If that occurs acutely or suddenly, the placenta provides oxygen to the fetus, and then the fetus will be acutely subjected to lack of oxygen. When a baby is subjected to lack of oxygen, their brain cells are insulted in two major ways. One is an acute, immediate death of the brain cell from lack of oxygen, and the second is what we call more of a delayed cell death that occurs because of the trauma or the biochemical abnormalities that are induced by the asphyxia or lack of oxygen.
Who can this help?
Well, there are certainly strict eligibility criteria, and in our community-based hospital, we pretty much follow the NICHD protocol. And if the patient is eligible, the patient will be placed on top of a cooling blanket, and we will program it to cool the child to about 92 to 93 degrees Fahrenheit. With whole body hypothermia, the cooling period of 72 hours is based upon a period of time that we feel will minimize the acute abnormalities that the brain is subjected to. However, the brain as well as the whole body is still subjected to very severe insult, and we manage the child with traditional intensive care during that period and subsequently. What we found in the randomized clinical trials is that patients who benefit from this period of neuroprotection long-term have decreased mortality and independently decreased neurodevelopmental disability in follow-up.
New technologies and procedures to help correct pediatric conditions are being developed continually, allowing these children to grow up healthier. For the American Health Journal, I'm Laura Windsor.